Long before we ever became specialists or general practitioners or surgeons or radiologists, we were always general medical officers. And we have got a very generic skill set. And that's how we've been trained. We've been inherently trained to work as general practitioners. And earlier in my career, I did consider general practice in my own professional development. I even applied for general practice training program in the UK twice, but I did not get on at that time because of some visa restrictions. I remember when I was in the UK, I was working with one of the orthopedic surgeons, and I was there sitting an exam for general practice entry. And then I saw her, and she came to me. She said, "Rizwan, can you please keep absolutely quiet? Don't tell anyone that I'm doing a general practice exam." I said, "Look, you are an orthopedic trainee here in the UK. It takes a lot of effort to get onto the training program. Why would you even consider general practice?" She said, "Yes, I agree. And I acknowledge that it is a very difficult effort to get onto the orthopedic training program. But I'm going to be in general practice because I'm starting a family. And my husband is also a doctor. And I think for me, the priority is family. And I think, given my circumstances, general practice might be the way forward for me." Now, not only that, when I moved here in Australia, I saw lots of IMGs who were working along with me might be having an aspiration to become a surgeon, to become an orthopod, or to become, a radiologist. After about a few years of their passionate inclination towards a specialty, they would gravitate down to general practice by and large because it's an easiest specialist entry. It's a full qualification specialist program, which is the shortest training program ever. If you want to train as a general practitioner and you've already completed 1 or 2 years of hospital medicine in Australia, the training program is only then 2 years. So it is the fastest route to become a specialist in family medicine here in Australia, and your salary is pretty good to start off with. The third category that I have come across is the people who have been on training programs. So that might be a surgical training program, emergency training program, even physicians training program, and they have not been able to complete the training, number one, or they have not been able to complete the fellowship exam. And there are quite a few doctors in that category as well. And I've known personally at least two of a very good emergency physicians who unfortunately could not pass an exam, and they are now working as brilliant GPs. And I think this is very important to understand that GP category or family medicine category always welcomes you. In this video, I would like to tell you that no matter what your experiences, what your aspirations are, there's always a place for you in general practice. And I'll start off with some of the career guidance notes on that line. We'll take it from there. Whenever I do career consultation, I hear this all the time. Dr. Rizwan, I'm tired of hospital shifts. I just want to become a GP, have a better lifestyle. Can I even do that without any prior GP experience? Or I have actually worked as a GP overseas. Can I fast track my career as GP in Australia, taking into account all of the previous experience that I have? Now, if you've ever wondered which pathway is right for you with or without GP experience, this video is going to be an absolute gold mine. In this today's video, we will cover your options to become a GP here in Australia. Number two, pathways to become a GP with no prior GP experience, and pathway to become a GP with some experience. Fast track options if you have significant GP experience, and overall conclusions at the end of the conversation. So let's dive in. Why are there so many pathways? You've got to ask this fundamental question because Australia is facing a critical GP shortage, especially in rural and regional areas. By 2032, Australia will need over 11,000 GPs, and international doctors, IMGs, are a key part of this strategic solution. And here are the main pathways: AGPT or Australian General Practice Training Pathway, Fellowship Support Program, Practice Experience Program, which is now merged into FSP Specialist Program, PESCI or Pre-Employment Structured Clinical Interview, ACRON, which is Australian College of Rural and Remote Medicine. And also, please note that MDRAP, More Doctors for Rural Australia program, has now been closed to the new applicants. If you're a junior doctor and you've never worked as a GP, don't worry. You also have an excellent chance too. Your best bet is AGPT. Now, AGPT pathway or IMGs, the eligibility criteria is that you need to have passed the AMC 1. After that, you should have completed either a WB or AMC clinical exam to get a general registration. You need to be an Australian citizen or permanent resident or New Zealand citizen. Temporary visa holders are not eligible. Pesky requirement. If you don't have previous GP experience and you're really going to relocate to any regional or far out rural area, pesky might be required before you start the GP work or training. Other checks which are required include police clearance, working with children, successful application through AGPT competitive process. Now, it is important to note that AGPT is competitive. Duration of the program is 3 years, is standard full-time training, and 4 years if you opt for the rural journalist pathway, which means that you're basically gaining some extra rural experience by devoting 1 year in the very remote and rural areas. Now, training structure, the first year is that of the hospital rotation. So if you already completed the hospital rotation, you obviously don't need to repeat that. Year 2 and 3 are purely general practice placement, usually rural or regional, depending on where you match. The salary during the AGPT training is expected to be between 80,000 to 110,000 for GP training year 1. It increases to up to 120 to 150,000 per year for GP year 2 and 3. Now, billing split exists, so you might be able to share the billing that you're generating for that practice up to 45 to 50%, depending on how the owner works it out. The other benefit, you get paid leave, superannuation, and also if you work in rural or far out in regional areas, you get incentivized in terms of your salary. Alternatives. Fellowship support program. If AGPT isn't an option for you, then fellowship support program is the main pathway for most IMGs as of today. Now, fellowship support program eligibility includes Australian medical registration, ideally journal or provisional with level 3 supervision, working rights obviously here in Australia through citizenship, PR or visa with unrestricted work rights. Now, jobs must be in MM2 or MM7 regional or rural Australia. Now, RACGP accredited practice with accredited supervisor. Minimum hours 14.5 hours per week with 10.5 hours clinical face-to-face interaction during that training scheme. What are the programs detailed? 24 months duration, online modules, workplace-based assessment, and assessments which also include some face-to-face time. So it's a very robust and very interactive program through your training. Because it's a fellowship support program, so you may have to fork out about 15 to 18,000 self-funded fee to be in this program. But the common question arises, how can I afford the fee? Well, you will be getting paid as a doctor and some of the practices can subsidize part of this fee. What if you already have some GP experience overseas? That's a very good news. Prior GP experience can really speed up your journey with qualifications like MRCGP, MICGP, or Arab Board of Family Medicine. And there's a whole list of programs which are accredited in, and I've included the link. So please do check it out. You can qualify directly for FSP or PEP pathway. It will reduce your training time to up to a year only, in which you get a top-up training. You can start earning faster and much better, especially if your placement is in rural areas. And here's a quick snapshot of some of the key programs which have really great traction. UK MRCGP, Ireland MICGP, Canada, Certification College of Family Physicians, Hong Kong, Malaysia Conjoint Fellowship, ICFRACGP, USA American Board of Family Medicine Certification, Saudi Arabia, Saudi Board in Family Medicine, South Africa FCFP, South Africa, Sri Lanka MD Family Medicine with Specialist Post Certification. Now, what about after completion of your training? After the completion of your training, you need to do fellowship exam, RACGP Fellowship or ACREM Fellowship. There is also a consideration of 10-year moratorium, which means that you will be working in DPA or district priority areas for Medicare rebates. Now, earnings for GP are good. Normally, you would be able to easily make up to $250,000 to $350,000 annually. That's pre-tax and gross salary. And in high demand areas, this salary can increase up to $400,000 to up to $500,000, especially if you're doing some procedures and some urgent care services. So what's the conclusion? Why GP is the smartest pathway for IMGs? Well, general practice is in demand and looks like it will be in demand. It's flexible, especially if you've got an interest like urgent care, women's health, mental health, pediatric. Everything can be incorporated in general practice. If you are a surgeon back home, wherever you're coming from, and you can take that experience into the general practice while practicing in some of the regional rural areas. It's family friendly. It provides stable income and work-life balance. And, that's why we see lots of lady doctors working in general practice. Now, obviously, there is no guarantee ever, but it looks like looking at the history and the projected forecast, at least 10 years, and you've got an extremely good chances to get an employment as a general practitioner, even open up your own practice. So whether you don't have any GP experience prior or years of GP experience, or even if you're coming from other specialty, there's always a pathway for you. Unsure which pathway to choose, AGPT, FCC, or specialist pathway, PEP pathway, you can book a consultation with me or my team, and we can take you through looking at all of your credentials and make a very tailored management plan for you. So look after yourself and each other, and I'll catch you in the next video. Thank you and goodbye.